Hello there, welcome to FloodGate's Industry Breakdown. Here at FloodGate, we work with thousands of forward-thinking candidates every month. They often ask us which markets are hot and which ones are not, which ones are growing and which ones are dying. In response to these inquiries, we started creating bite-sized snapshots of the product categories that we know well, so that you can stay ahead of the curve and make sure that you're always planted in a growing sector of the market. Hopefully you saw last month's edition of the wearable technology space, which is absolutely exploding. If you didn't, we'll include a link to that piece at the end of this video. In today's breakdown, we're going to cover a product category that was once a sleepy little sector, but has blossomed into a $20 billion industry over the last decade and shows no signs of slowing down. We're talking about the advanced wound care market. If you're already in the advanced wound care market or possibly considering a career move into the space, we think that you will thoroughly enjoy this breakdown. Over 6.5 million people were affected by chronic wounds last year alone, which means that over 2% of the entire population is being affected. It is very likely that someone in your immediate or extended family is being treated for a non-healing wound right now. Not only is this a huge market right now, but leading analysts predict that this category will double again over the next 7 years. The most mind-blowing statistics for this product category are not even related to revenue or revenue growth, but to amputation and mortality. The Diabetes Council recently reported that more deaths were related to chronic wounds than to prostate and breast cancer combined. I actually had to see those figures to believe them. Before we go any further, I think it's important to back up and first clarify exactly what we're talking about when we use the term wound care. At its most basic level, a wound is an injury to a living tissue by a cut, blow, or other impact. Wounds are classified as either acute wounds or chronic wounds. Acute wounds typically last for 8 weeks or less in duration and follow the normal stages of wound healing, whereas chronic wounds do not proceed through the normal healing stages and can last much, much longer. Chronic wounds get most of the attention because they cause most of the problems. So we're going to focus on this subcategory for today's segment. So how do people get chronic wounds anyway? Well, the most common factors that contribute to the development of chronic wounds are diabetes, obesity, cancer, old age, high blood sugar, poor circulation, nerve damage, immune system issues, poor nutrition, immobility, and of course, surgery. Now that we've defined the space and covered how wounds develop, let's talk about the treatment of these wounds by looking at the most prominent caregivers, the care settings, and the products themselves. Unlike orthopedics, cardiology, and urology that have very specific medical school training programs and fellowships for their caregivers, the wound space leverages many different types of physicians to treat their patients. It would not be uncommon to see chronic wounds being treated by vascular surgeons, general surgeons, plastic surgeons, podiatrists, and a whole army of super passionate wound certified clinicians. As you can see here, these wounds are treated in a variety of care settings, with most of the treatments happening in the hospital and the affiliate outpatient wound care center. The product landscape for this advanced wound care market is absolutely massive, with over $15 billion spent on products alone for this category. Our team identified 1,700 different products from over 250 companies that are used to treat non-healing wounds. According to our source, the 3 companies who currently own the lion's share of the market are Acelity, Smith & Nephew, and Mölnlycke. Wound care products fall into 4 primary buckets. The first and largest category is the advanced wound dressing market. This subsector is super crowded, with 62 companies competing against one another with similar product offerings and constantly evolving science behind their ever-expanding product portfolio. The second and fastest growing category is the biologics and skin substitute category. The technology used in some of these products is nothing short of amazing. One of the products from a company called Organogenesis is basically a living Band-Aid. If you were to set this product down on an exam table and cut it in half, it would actually grow back together again. It's absolutely crazy. Third category holds all of the wound therapy devices. The 800-pound gorilla in this category is what they call a negative pressure wound therapy device, which actually acts like a vacuum for the wound. This category has and continues to be dominated by Acelity, who owns most of the market with her VAC product line. However, there are some really cool adjunctive therapies like mist, Kerasis, and a whole bunch of others that work really well in certain situations. The last category is really a catch-all for those products like hyperbaric equipment, patient lifting equipment, contact casting, and others that do not fit in one of the buckets above, but play a critical role in the world of wound healing. Well, that's it for this week's breakdown. We hope you enjoyed the segment and maybe even learned a little bit. If you'd like to learn more about this product category, make sure to check out our Buzz report by clicking on the link below. And of course, leave comments and follow us on LinkedIn, Facebook, Twitter, Glassdoor, and subscribe to our YouTube channel. See you next time.